Good evening and a warm welcome, dear viewers, to today's episode of Visite. In reviewing the many inquiries to me, I always notice that we have to talk about one topic, and that is depression. Depression, especially among the youth, among our children. This is increasingly a really serious concern, as is the development of autism or ADHD, this hyperactivity of children. It is incredible that we can really speak of an endemic or pandemic here, because with autism, for example, every 100th to 150th child develops into an autistic child. That is to be taken seriously. We shouldn't just accept that. And the cause for these disorders, from depression, autism, sleep disorders, mental illness, is very often found in ourselves. Of course, it is very often the general conditions that make children feel overwhelmed, that they can no longer concentrate, that they cannot cope with the separation of their parents. These are the things that are around us, and that are definitely too much for a small, delicate soul at times. And yet the situation is completely out of hand. When we let children grow up who no longer have any structures at all. Those who practice a daily diet that completely unbalances their intestines. The intestine is the root of the human plant. So when I have an apathy towards fruits and vegetables, when my diet consists of pizza and sweets and chips and Coke, and all of these things, then I unconsciously destroy the most important immune organ. And that's my gut. That's my intestinal mucosa. That is where chronic inflammatory processes begin to develop into everyday occurrences. But now it is the case that the happiness hormones in us, which make us satisfied, which make us thankful, have to be created by us. And we make them from tryptophan. Tryptophan is an amino acid that we can get from wheat bran, for example. Tryptophan is metabolized into serotonin in the body. And this serotonin is the happiness hormone. Only 1% is converted into serotonin. But this serotonin is working now in the brain at important centres to make us feel joy. When we have a child, a teenager, who is depressed, then maybe they have a vitamin B6 deficiency. So they cannot convert this tryptophan into serotonin. But if they are taking serotonin reuptake inhibitors, like normal antidepressants, a metabolic product develops. Like normal antidepressants, a metabolic product develops, which accumulates and acts toxic on the entire endocrine system. This tryptophan, which is not further metabolized into serotonin, is diverted into another cycle. This is called the kynurenine cycle. These misdirected metabolic processes happen in these children because through these chronic inflammatory processes, processes in the intestine, this dysregulation is created. And we have only known that for the last 15 years, a big correlation between gut and brain. The inflammation of the intestine is the inflammation of the glial cell as well. This is the entrance gate. This is the intracellular space in the brain, and it has an incredible impact on the signal transmission of the brain. In this programme, and also a lot in the conversations with Alexander Glog, we discuss metabolic disorders. For example, the so-called pyroluria. That means these children are discharging without anyone noticing. Zinc and vitamin B6. But if they can no longer do this synthesis step in the intestine to convert tryptophan to serotonin, because the valuable vitamin B6 is not available to them, these children are often conspicuous by depression, by restlessness, by sleep disorders. As part of the cofactors for the production of serotonin, we also need iron. We also need copper. We also need magnesium. And we need vitamin D. But zinc and vitamin B6 are crucial keys for this synthesis path. Treating chronic inflammation must understandably first be analysed. Which child, which adolescent, who is then very quickly also in the care of a colleague, who of course now tries to stabilise this clinical picture through their conversation, but also through supportive medication of psychotropic drugs, can and will be interested in it? No one. The electric smog today, the high radio pollution, permanent mobile phone use, are really fire accelerators for this whole thing. And now I'll find the bow back. Visite is a series where you ask me questions. And I wanted to put that first, so that you understand what concerned me when I read the email from Jolene's mother. And Jolene's mother writes that Jolene today is 17 years old and has been in a closed section mental institution for 2 years and is still suicidal today. As a small child, she was cheerful and open-minded, very curious, compassionate, and very, very sensitive and intelligent, and mastered everything very well. When the parents got divorced, it was a first difficult phase in the life for the little one, and a sign of how much you are mentally stressed is the development of shingles. That is very typical in the case of such severe impacts. Also psychological, stressful situations that the children can then go through. And life slowly developed a certain gravity, because as a child you may not be able to choose whether mum and dad separate. Then there was already a drop in performance at school, a latent depressive mood. There was slight self-harm and the first thoughts to end the life. And the parents then sought protection in a psychiatric clinic. And she's been there for 2 years. And at the beginning, the parents only have wanted a natural accompaniment, but due to the really critical assessment of the local specialist colleagues, then of course they also said yes to the path that is being taken there. But after the condition of Jolene did not improve, but on the contrary worsened, the parents noted, could it also be a pyroluria that we are overlooking? Could it also be toxic exposure that she has had? It was not investigated, and I can well imagine that the specialist colleagues are also overwhelmed in this regard, because it's simply not their strategy to pursue these things. But they are trying to stabilise the current state. Since April the 1st, 2019, there is a diagnosis of a depressive episode with psychotic disorder, with a personality disorder, with a borderline, with an autistic spectrum disorder. It is getting more and more. And now I read how Jolene is treated with sertraline, with pipamperone, with Truxal, with promethazine, with ketapine, and with vitamin D3. I have laboratory results here. Unfortunately, they are from April 2020. And I really ask you from the bottom of my heart, I hope this is not the latest vitamin D value, and I can't really imagine that this little one was outside a lot. You are not in a closed section for nothing. In other words, you have really almost no daylight or natural light. But back then, the vitamin D3 value was already pretty low. The laboratory measures here in micrograms per litre, normal value over 30, and that was below the norm value of 25. When there is no more light in us humans, then that means that depression is very much linked to a decreased build-up of all these hormones. Vitamin D is the hormone that is not only essential to life, but also essential for survival. And in a case like Jolene here, twice a year, we have to make a statement about what her vitamin D level is like. And if it is not activated by the light, vitamin D is an endogenous product. But if the activation does not come through the light, then we have to substitute here to a high degree. And I ask you as parents to really let them show you what the current vitamin D level is for Jolene. Just from my experience, when we get these people out of this depression, it is a completely different metabolic economy in the deployment of such synthetic processes, and joy and satisfaction can return when vitamin D is in balance again. But I don't want to take this as an answer. There is much, much more at stake here. A pyroluria must be excluded. And it must also be looked at how is the intracellular zinc. A broad vitamin profile must be created to see what about vitamin B6, B3, B2. You have to look at the methylmalonic acid in order to know, does the cell have enough vitamin B12? Because vitamin B12 is our important nerve vitamin. Vitamin B12 deficiency alone makes us spiritually, cognitively, and mentally exhausted. The sertraline is a so-called selective serotonin reuptake inhibitor. So if you've been taking this drug for weeks and months, then the natural serotonin production is no longer working because of this toxic metabolite. That means here too it is important to make an amino acid profile. You can also create a profile This is the so-called organics neuro, where these metabolic products are tested in urine. And there you would see how high is this metabolite just by taking this reuptake inhibitor. In other words, at the end of the email, you wrote, "The lust for life is still not back. I wonder how is that supposed to work?" And we have to look deeper. We really have to look now. What is the situation in the intestine? What is her diet there? Does she have gluten there? Does she have a leaky gut by now? Is she pushing all the toxic load into her organism? Of course, that's what also causes brain fog. Sometimes this also creates psychological conditions. It causes a fatigue depression. The pipamperone is given in cases of restlessness and excitement. This is a neuroleptic that is used for sleep disorders. And there is a big question. Especially with adolescents, you should really evaluate the risk-benefit ratio, especially with children up to 18 years. And it causes a lot of extra pyramidal side effects. Please don't let me list them all here now. But it seems to me that she has to be protected from herself, and that's okay too. But you shouldn't put even more stress on her at this time, which she's not been able to handle with her organism for a long time. And also the Truxal, which she takes next to the pipamperone, is to lower the excitement. Also with a corresponding mental state. That can make you tremble. It can cause disturbances in the movement processes that in turn is the risk to completely different things that can develop into sleep disorders, dry mouth, drooling and so on. Often the medication causes severe constipation symptoms in these children. In the case of intestinal dysbiosis, which I suspect that would now be very unfavourable, they have a lot of appetite, they're always tired, they're weak, they have trouble sleeping. And the quetiapine she is taking is actually used in children who are having depressive episodes but have bipolar disorder, in manic episodes and in schizophrenia. And especially with children who are not yet 19 or 20. So in these developmental phases, there are really strong side effects in the form of liver problems, thyroid disorders. There are no long-term studies available in children between 16 and 27. You don't really know what will develop from the drug. At this point, I would like to appeal a bit that I recognise the helplessness on one side of you as parents. But you are the parents who are ultimately responsible for Jolene. And I would like to ask you to have an open and clarifying question with your colleagues so that there can be external help on the medical side that enables us to help Jolene return to a normal life. This path that I see here cannot build this bridge for her because it is too small, it is too limited. And it's about treating depression of a young person at risk of harming themselves. But we have to give her the chance to get out of this life situation because she used to be healthy. And it is the things in her young body that no longer allow her and have not been in balance for a long time. And now you need the groundwork, you need cooperation. So you need to be there for each other so we can, at this point, also help the colleagues. And when there is openness, and when the urgency is also there, that you as parents see, just like me, that there has to be a turning point in the treatment strategy with everyone together, then you should find people and doctors who see it just like me and who stand up for you, and maybe also with a family doctor. And together with these colleagues, and really quickly, organise a diagnostic that enables us to say exactly what Jolene needs, because it's not about the depression, it's always about Jolene. And for that you need light and sun and love to get her back to life. And it doesn't need now, I think, this one-sided therapy that inevitably prevents us from getting any further. And every day somehow my heart gets a little sad when I see what you're going through as a family. You still wrote lab results attached. I saw these lab values, but for me they in no way give a clear picture of Jolene. Magnetic resonance imaging, EKG and MRI of the skull are normal. Yes, I should hope so. But that doesn't mean that there aren't an infinite number of other things we should understand. And that should be considered, so Jolene will be healthy again tomorrow. With this in mind, I sincerely wish you all a wonderful Sunday evening, and above all, also a very good week and a nice week to come. I'm really looking forward to next Sunday, and until then, all the best to you.